I am Anil Johari. I am from the National Accreditation Board for Certification Bodies, and I will speak to you about accreditation today. This accreditation is different from the accreditation of educational institutions or healthcare that you might have heard of. Internationally these days, increasingly standards are being used for products, for services, for processes, for systems. They can be mandatory standards on grounds of health, safety, environment, etc., or these could be voluntary standards. Once standards are used, then you need to check compliance to the standards, whether they are compulsory or voluntary, and that is called conformity assessment. That's done by either inspection or testing or certification. As the use of conformity assessment has grown, there were two issues which have come worldwide. First, the confidence in conformity assessment. Is the lab competent to test what I want to test? Is the inspection body competent to inspect what we want inspected? And second issue that came up was about cross-border acceptance. With the global trade growing, we want that a product which is tested in one country, that test report should be acceptable in another country. If it is certified in one country, the certification should be acceptable in another country. This is accomplished through what is called accreditation. Accreditation finds a mention in the WTO Technical Barriers to Trade Agreement in Article 6 for cross-border acceptance. So that's the importance that accreditation has got. To give you some definitions, conformity assessment is defined as demonstration that specified requirements, which means standards, relating to a product, process, system, person or body are fulfilled. Conformity assessment includes activities such as inspection, testing and certification, as well as accreditation also. Accreditation is third-party attestation related to a conformity assessment body conveying formal demonstration of its competence to carry out specific conformity assessment tasks. This definition comes from a standard made by ISO, which is International Organization for Standardization, ISO 17000. Now, third party means independent. First party is the manufacturer, second party is the buyer, third party is neutral. Conformity assessment body you already understand, formal demonstration of its competence. So, we are looking at competence of a laboratory or a competence of an inspection body or competence of a certification body. Sometimes accreditation and certification are interchangeably used or not understood properly. So, one crucial difference is accreditation is all about competence. Is the lab competent? Is the certification body competent? Is the inspection body competent? There are a number of accreditation standards. These are made by a committee in ISO, which is called Policy Development Committee on Conformity Assessment, CASCO in short. And as you can see, there are a number of standards. There is one for accreditation bodies themselves, ISO 17011, and the common ones are ISO 17020 for inspection bodies, ISO 17021 for management system certification bodies, those who certify for ISO 9000 or ISO 14000, ISO 17025 for laboratories, testing and calibration laboratories, and ISO 1765 for product certification or process certification bodies like ISI mark or egg mark, that is product certification. Those are covered by ISO 17065. There are other supporting standards which are sector specific like ISO 22003 for food safety, 27006 for information security and 50003 for energy management. These are all read with the main standard, that is ISO 1721. Now, accreditation in India is handled by an organization called Quality Council of India. This was established in 1997 through a cabinet decision, and it was a unique organization established in partnership with the three industry bodies, CII, FICCI and ASSOCHAM. It's an independent body and it's a successful example of public-private partnership. It's registered as a society and its chairman is appointed by the Prime Minister. As you can see, some very eminent names have been chairman of QCI, like Mr. Ratan Tata, who was the first chairman, Mr. Venu Srinivasan of TVS Group was the second chairman, Dr. Mashelkar, a famous scientist, Mr. Arun Mehra recently, who was member of Planning Commission, and currently we have Mr. Adil Zainul Bhai, who was chairman of McKinsey India as the current chairman. Our nodal department or ministry is the Department of Industrial Policy and Promotion in the Ministry of Commerce and Industry. The main function of QCI was to provide accreditation framework in the country at par with the international framework that was growing. But we were additionally given the mandate to spread quality movement in India through what is called a national quality campaign, provide right and unbiased information on quality, represent India in international fora, and in general help establish quality of Indian products and services. QCI is very interestingly structured. As you can see, although QCI is the legal entity and the society, it acts like a holding company, and there are different boards. I come from NABCB, as you can see, which is the first board, primary board for which QCI was set up. Another board is NABL, National Accreditation Board for Testing and Calibration Laboratories, and you might have heard of it earlier. This was in Department of Science and Technology earlier. It has just been transferred to Department of Industrial Policy and Promotion. The cabinet decision was that NABL should become part of QCI at an appropriate time, and these actions are being taken now to bring it in the fold of QCI. We also have an accreditation board for education and training, another one for healthcare, and also a national board for quality promotion. The interesting part is that each of these boards is member of international body in its own name. It functions autonomously within QCI. So it's almost like an organization within organization. NABCB's mandate is to accredit certification and inspection bodies as per international standards. Generally, ISO standards are used. NABL's mandate is to accredit testing and calibration laboratories. They are now also accrediting medical laboratories, proficiency testing service providers, and reference material producers. Along with NABL, NABCB is part of an international system of accreditation and equivalence. These systems are operated under two international bodies. One is called International Accreditation Forum, which relates to accreditation of certification bodies, and another is International Laboratory Accreditation Cooperation, which relates to accreditation of labs as well as inspection bodies. In the international system, as I said, these are the two international bodies, IAF and ILAC. Then there are regional bodies. In our region, we have two bodies, Pacific Accreditation Cooperation, which is for certification bodies like IAF, and Asia Pacific Laboratory Accreditation Cooperation, which is for inspection bodies and labs like ILAC. PAC is a member of IAF, and APLAC is a member of ILAC. There are similar bodies in other continents, but they are single bodies. Unlike in Asia Pacific, we have two bodies. In rest of the continent, there is a single body. For example, European Accreditation Cooperation, EA in Europe, Inter-American Accreditation Cooperation, this is in North and South America, and there are growing new bodies, African Accreditation Cooperation and Arab Accreditation Cooperation. There are mutual recognition arrangements defined by these two bodies. They are called MLAs in IAF and MRAs in ILAC. In India, as I said, NABCB and NABL are the national accreditation bodies with a very defined domain. Now, how does international equivalence come? All the accreditation bodies like NABCB and NABL also are expected to comply with this international standard ISO 17011. We are assessed by our peers, it is called peer assessment, for compliance to ISO 17011, and if we are successful, we can sign an MRA or an MLA in IAF. For example, as you can see, NABCB signed the PAC MLA for quality management systems way back in August 2002. Once you sign the regional MLA, then based on that you sign the IF MLA also, because IF evaluates PAC, ILAC evaluates APLAC. So they accept the results of PAC evaluation. So you can see there is time difference is very little between the two. We signed PAC MLA for QMS in August 2002 and IF MLA in September 2002. Then for EMS we signed it in PAC in July 2007 and IF MLA in October 2007. Then for product certification we signed PAC MLA in May 2013 and the IF MLA in August 2013. The APLAC MRA for inspection was signed by us in September 2013 and the ILAC MRA in same month, September 2013. Then we also signed the Food Safety Management Systems MLA in PAC in June 2014 and also the ISMS MLA in the same in June 2015. Also we signed the IF Global Gap MLA in October 2014, And in October 2015, we signed the IFMLAs for both food safety management system and information security management systems. Incidentally, NABCB, one of the 3 accreditation bodies around the world to have signed IFMLA for ISMS. That's our standing. And we are one of the 11 accreditation bodies around the world who have signed IFMLA for FSMS, Food Safety Management System. So, the NABCB is on par with international bodies anywhere in the world. Similarly, NABL also has signed the necessary MRAs of APLAC and ILAC for testing and calibration laboratories since 2000, for medical labs since 2008, and they have just been evaluated for proficiency testing and reference material production, and hopefully within next 6 to 8 months they should get the MRA for these 2 activities also. So, as you can see that India has a world class accreditation infrastructure available here. The significance of international equivalence is that when a certificate is issued with an NABCB logo or a test report is issued with an NABL logo, it should be acceptable worldwide, because that logo is a sign that it is the testing lab which has tested, or certification body which has certified, or an inspection body which has inspected. They have been accredited by an accreditation body which is signatory to the mutual recognition arrangements. This is to show you the equivalence framework, how the equivalence works in a pictorial form. As you can see, at the top are the international bodies, IF and ILAC. Next layer is of the regional bodies, and today there are 3 recognized regions: EA, Asia Pacific, which is represented by 2 bodies, as I said, PAC and APLAC, and Inter-American Accreditation Cooperation. So, IF evaluates these regions. These regions evaluate the individual accreditation bodies. So, we are evaluated by PAC for certification body accreditation and by APLAC for inspection body accreditation. NABL is evaluated by APLAC for laboratory accreditation, and we have to follow a standard ISO 17011, as I already said. Then the bodies that we accredit, the certification bodies, the inspection bodies and the laboratories, they have to follow a common worldwide standard. Again, they are listed on the right hand side, as you can see, ISO 1720 for inspection bodies, ISO 1725 for laboratories, ISO 1721 for management system certification bodies, and ISO 17065 for product and process certification bodies. And finally, these bodies evaluate manufacturers or service providers against their standards, or they test them, or they test the product, or they inspect the product, or inspect the process, or they certify the product, or they certify the organization or the processes. And as you can see, this is where the international equivalence comes. If the standard at this stage is common, for example, ISO 9001 for quality management systems, or ISO 22000 for food safety management system, then the entire chain becomes equivalent. So, an ISO 22000 certified food business here in India can claim that he is on par with any other business holding ISO 22000 certification anywhere in the world. Now, translated to products, if the product standard is common, then you can see that the same product manufactured to the same standard in India and elsewhere, it can be traded easily because they are equivalent. So, the product that we make here and the product that is made in US, for example, would be equivalent. So, if this lowest level of standard is common worldwide, then you can trade very easily, and that is the purpose of accreditation. This is the global vision of these 2 international bodies. Ultimately, what they want is that tested, inspected or certified once and accepted everywhere. That is the vision, that there is no repeat testing, there is no repeat inspection. We can trust testing done in another country, or certification done in another country, or inspection done in another country. So, you can see that accreditation has great value. First one, it is recognition of technical competence. As I said, in the definition itself, it has been emphasized that accreditation is about competence. Is the lab competent to test pesticide residue to ppb level, or ppm level, or ppt level? Is the inspection body competent to inspect engineering items or to inspect food items? There is different competence required. Is a certification body competent to certify electrical engineering manufacturers, or is it capable of certifying aerospace manufacturers, or food manufacturers, pharma manufacturers, different competencies are required. Accreditation also gives the customers the confidence and satisfaction that the product which has been tested or certified is coming from somebody who has been subject to an oversight. It also minimizes risk. For example, when government wants to, any organization wants to send samples to a lab, it can have more confidence if the lab is accredited. Otherwise, you have to find out whether the lab would be able to test, is it competent or not. It also avoids retesting and reinspection, and that also reduces cost in transactions. There is more efficiency. There is marketing advantage. The lab which is accredited would claim so in the market and be seen as better than the other labs which are not accredited. And also it provides, of course, international recognition, which is one of the primary reasons for having accreditation in the first place. So, given this situation, there is a regime which is emerging worldwide. There are areas which will be always under regulation. Food will be under regulation, drugs will be under regulation, medical devices will be under regulation, electrical appliances because of safety reasons will be under regulation. The regulatory bodies are increasingly seeking accredited conformity assessment bodies because they are stretched for resources, they are stretched for expertise, so they are relying on this system. There is a separation taking place where regulation is separated from accreditation, and accreditation of course is separated from conformity assessment. Similarly, in the voluntary space, it's the scheme owners, the one who owns the scheme. Like in regulatory space, it's the regulator who's at the top. In voluntary space, the scheme owners are at the top, and they invariably prescribe accreditation to international standards for the certification bodies or inspection bodies or labs which are used in their scheme. Examples would be, for example, Global Gap certification for good agricultural practices, or FSSC certification of food businesses, or SA 8000 certification for social accountability. All these require accredited conformity assessment bodies. Now, these days, many countries are entering into bilateral or even multilateral free trade agreements, and accreditation is seen as a means of accepting conformity assessment across borders, because in that trade we want to eliminate barriers. We want that what we produce here in India should be accepted by our trading partner. Some of the examples given are, for example, ASEAN countries have an MRA on telecom, so the telecom products can move within ASEAN countries certified at one place. Similarly, India and Singapore have a free trade agreement in which accreditation has been prescribed for electrical and telecom sectors, based on which the products can be traded. Worldwide, some important developments have taken place. For example, EC brought out a regulation in 2010, as per which every country has to have a national accreditation body there. They have to be non-profit, public service and non-competition, and although it doesn't mandate so, but it pushes every regulator in European Commission to rely on accreditation. Similarly, US FDA has also amended its rule to incorporate third-party assessment and certification, and they are going to use accreditation as a means of their competence of these bodies. So, this is how the emerging structure is now. The government increasingly will be limited to making legislations and policies. It will establish independent regulators like it has done in India, FSSI you know already. Then there will be national accreditation bodies like NABCB and NABL. There will be conformity assessment bodies in private, generally in private sector. It is increasingly seen as a private sector activity. There will be manufacturers and service providers who will use these conformity assessment bodies, and finally common people will get the goods and services. So, India also is following the international trend. Indian regulators have begun to realize the value of accreditation. One of the first regulators to rely on accreditation was Petroleum and Natural Gas Regulatory Board, which is relying on accredited inspection bodies. The Food Safety and Standards Authority of India is also relying on accreditation. It has already notified NABL accredited labs, and it's thinking of notifying NABCB accredited bodies for food safety audits. Even medical devices regulation is being contemplated, and it is expected that it would have a concept of notified bodies which would be accredited. There are several examples of regulators and government agencies which are using accredited labs. Lab accreditation has been much older in India. For example, Bureau of Energy Efficiency for its star rating program, Department of Electronics and Information Technology for its regulation of electronics and IT products. They are all using labs which have to be accredited. In case you need any further information on accreditation, you can contact NABCB at the address that has been given here, including the email IDs and the website you can visit. And similarly, NABL, which is housed separately in Gurgaon, you can visit their website. All the accredited bodies, the details are available on website. The whole system functions very transparently. So if you go to the website, you can see which lab is accredited for what purpose, which certification is accredited for, certification body is accredited for which scope. Is it accredited for pharma? Is it accredited for food? Is it accredited for medical devices? That's all this information is available on our website. So you are welcome to visit the websites. You are welcome to write to us. Thank you.